Good evening, I'm Lee Anderson. The mask mandate in healthcare settings ends a month from today. The Oregon Health Authority made today's announcement almost 3 years to the day after the state's first confirmed COVID-19 case. Blake Mayfield breaks down the decision and has reaction.
The April 3rd end to the mask mandate seemed to come as a surprise to Central Oregon healthcare providers. Clinics and doctors are now working to determine what visits for patients will look like in a month's time.
Lifting the masking requirement in healthcare settings is a positive step in our ongoing response and battle with COVID-19.
The decision from the Oregon Health Authority ending the mask mandate impacts physicians, dentists, physical therapists, and other healthcare providers.
Obviously mixed as a human being. I'm so excited to not have to wear masks at work all the time. But of course, as a physician, I have mixed feelings.
At West Bend Family Medicine, Dr. Raphael Allred says the clinic is looking to form its own guidelines, which may include masks in certain parts of the clinic, like the waiting room.
In general, the waiting room is where you're going to find the most transmission happening just because you have people there. Especially in family medicine, you've got geriatric patients who are more at risk, and then you have little children who have coughs and colds, and then you have teenagers coming in with who knows what.
The state's epidemiologist says the move to end the mask requirement comes as a result of cases in COVID-19, RSV, and influenza tapering off this winter.
Indicators of spread of COVID-19 as well as influenza and RSV have decreased significantly in the last few months and are continuing to show a declining trend, which is great.
The St. Charles Health System is working on a response, their chief medical officer said in an email. An internal group of experts will meet to review the rule change and will share plans once the review has taken place. At Summit Health Oregon, the chief medical officer said in part, people at higher risk for severe disease or who live with someone at higher risk should still consider wearing masks in healthcare or any settings. Patients had mixed reaction to the news about the end of the mandate.
I think it's about time we kind of let go of the mask illusion. I think, oxygen is good, and I think sometimes the overdone issues around the mask is really, it's just not necessary.
I think that in areas where the concentration of disease is likely to be higher, such as hospitals, it would make sense to me that one would want to perhaps continue the mandate.
The current mask mandate was put in place in August of 2021 and was intended to be temporary, now ending next month.
For many, they're greeting this announcement with happiness. For others, particularly those with chronic conditions or who are immunocompromised, they're facing this decision with some anxiety.
Like with every other aspect of COVID, deciding to unmask permanently brings a lot of moral and health questions about what it's going to look like in the future. We don't know.
The OHA says the month-long lead-up to the end of the mask requirement gives the healthcare system time to determine their own policies. It also gives patients, especially those considered vulnerable, a chance to make plans prior to medical visits. Blake Mayfield, News Channel 21.